I would say the evolution was probably more simplicity. The idea at the beginning was first a small incision, and there's probably improve the retractors to do less damage when you use the retractors. And slowly I just realized I was able to diminish the release. And lucky with Medacta, we developed really a good instrument to make that easier. Revision, when you have a good experience of the primary and you feel confidence, it just maybe the best part of the AMIS technique, but you have to know where are your limits. That's important.
My AMIS technique evolved over a series of hundreds of cases, but I became a more elegant surgeon. And as I became more elegant and more familiar with the anatomy, I was able to extend that to other types of surgery, no release technique, revisions through an anterior approach, bikini incisions. So all these things sort of developed over time. I became more elegant, more proficient, more efficient, more predictable.
When I very first visited Frederick Lode in Paris, after he'd shown me a couple of the standard techniques back in 2007, he'd said, and sometimes I do it like this. And he'd shown me a bikini incision. So I knew it was possible. I knew it had already been done. And I started doing it for the ladies who were of an age where they might want to wear a swimsuit at some point in their lives. And I rapidly realized that it was greatly appreciated by the patients.
When we decide to go for the anterior approach, we don't make any distinction between patients. We operate all patients by anterior approach in most of the case, except the very specific case where we have to use another approach. But this is the first change, and after that, with time, we reduce the release that we have done. We change a little bit some technical details to go now for less blood loss with possibility to make outpatient surgery and same-day surgery. And also what changed with time is that more and more we use this approach for revision surgery, which is today about 90% of my cases for revision are operated by anterior approach.
From the beginning, it is becoming more easy, of course, and the time of surgery is shorter. I did not do a selection of the patients. At the beginning, it was only few cases selected. Now, the surgery by AMIS approach is okay for all the patients for any case. I did also some cases of revision, particularly for acetabular revision, and it's a new way to use the anterior approach in the future.
Ja, also man hat versucht, immer noch schonender, noch minimalinvasiver zu sein, noch sorgfältiger das Gewebe zu behandeln.